Talk about a cavity, it's not the only thing which you see like a dark.
Most cases are reversible also.
Oh. Nobody said tooth needs a diet.
And if you have sensitivity, we do recommend a sensitivity toothpaste, and
We don't use abrading toothpaste. That would include this.
you can try it at home.
Okay.
So they will have some gels of hydrogen peroxide.
Hello everyone. We have Dr. Padhumai, who is a dental surgeon with us today. So, Dr. Padhumai, your first question is, when you say dental surgery, how is it different from being a dentist? Because when we talk about a dentist, we talk about only the teeth, but the dental surgeon does a lot more than that. So, a little bit of introduction about yourself.
Okay. So this is a specialization over BDS. It's called as a maxillofacial surgery and MDS in maxillofacial surgery. So it deals with all pathologies and all fractures of the face. It deals with fractures. It deals with the TMJ problems, your joint problems. It deals with the fractures, the lesions of the jaw. So this is it's something in between medical science and a dentistry. So it's like a bridge between medical science and dentistry.
Oh, wonderful, wonderful, Dr. Padhumai. But today you are here to talk about very general, basic teeth issues.
Yes.
So I thought we'll dwell into cavities more, because that is one thing which anybody and everybody has got, right? So there's a lot more to cavity. So when you talk about a cavity, it's not the only thing which you see like a dark spot over there or a pain in the tooth, which comes in later, right? But beyond that, there's more. So can you just explain a little bit of what a cavity is, and then we will go to the rest of it.
Okay. So to begin with, let us see what a tooth is made up of. It is made up of various layers. The first one, the outermost layer, is called as an enamel. The second one is called as a dentin, and the innermost is the pulp, which contains the vital structures. So where this enamel and dentin is made up of so many minerals and crystals, which are called as hydroxyapatite crystals. So when the acid from the food you eat, like whenever you eat a sugary substance or the acids itself from the food that you eat, it attacks the it's a rest on the enamel, and the bacteria act on these sugary substances, producing more acids, and these can cause a layer of or a mineral to erode away from your enamel. So this is when this happens, you see a white specks. Okay. So this is what happens initially. Okay. These white spots are the initial caries, and these caries in most cases are reversible also.
Oh, okay. That's quite interesting. So
they are reversible
check regularly. Yeah?
Yes. Okay. So when you have a visit once in every 6 months, a dentist will be able to recognize these spots, and an early cure is possible. So whenever you address it earlier, you have very little tooth structure which is lost, and you can really do wonders. You can, with the change in your diet or with the change in you can use some hydroxyapatites, like nano-hydroxyapatite toothpastes, which can remineralize actually.
Oh, okay.
A change in your diet can also
now I would like to catch hold of that now, because we talk about diets for everything, right? You want to lose weight, you want to stay healthy, you want to be agile, your bone needs diet, nobody said tooth needs a diet.
Cleanliness, yeah.
Yes.
Oral hygiene and cleanliness does require a diet. So whenever you eat a lot of pizzas, chocolates, or sugary substances, they stick onto your teeth, your enamel layer of your teeth. So the bacteria act on them. It causes acids, and thus the remineralization takes place. Mm-hmm. So whenever you end your meal, make sure you don't have so much sugary, sticky foods on your teeth. Wash well, rinse your mouth well. And eating lots of fibers can also help. It can help in mechanical cleaning of the carrots. Foods like carrots can help in mechanical cleaning of your teeth. And apart from that, the tooth is embedded in sockets in bone, and hence for a good bone health, you need lots of calcium and vitamin D and vitamin K, and so diet does improve your dental decay counts.
That's something very, very interesting.
Because even saliva, when the saliva comes out, there are minerals into the saliva also. Yes. So your diet helps in your oral health.
And you were talking about some toothpaste. So what would you suggest toothpaste? I mean, of course, there are many types of toothpaste. Like people talk about charcoal in toothpaste, or salt in toothpaste. Then they talk about, so many other things for, especially for sensitive teeth, there are special toothpaste. So you recommend different toothpaste for different kind of a problem, and like how would you advise a person to pick the right toothpaste?
Okay. So generally, what a dentist prescribes is a fluoride containing toothpaste.
Okay.
So this is a FDA approved and ADA approved. The reason why we prescribe this is we like the fluoride will react with the hydroxyapatite and cause fluorapatite crystals,
Okay.
which are more resistant to acid attacks.
Right.
They are really, very resistant to acid attacks, and because of that, you'll have less caries prone. You'll be less caries prone. So this is what we generally recommend. But apart from that, if you have sensitivity, we do recommend a sensitivity toothpaste, and they also will have fluoride content in them.
Okay.
But when it comes to a whitening toothpaste, you should always be very careful in selecting them.
Oh.
So when you're buying whitening toothpaste in the market, you have to be very careful about what it contains, because when it contains hydrogen peroxide or carbamide peroxide, which are the most commonly used bleaching agents, the effectiveness may be there, but it can also, on a very long run, it can cause sensitivity. And charcoal toothpaste also, it is said to have a mild whitening effect.
Okay.
It is less effective when compared to other whitening toothpaste. It's said to have an abrasive action on the teeth and hence a whitening effect. So an increase whenever there is a high concentration of charcoal, you should also be aware that it's going to cause some amount of abrasion and it can cause sensitivity.
So if you have sensitive teeth, then advisably don't use abrading toothpaste. That would include this whitening toothpaste and toothpaste with charcoal also. That's quite interesting revelations about teeth. Well, when you talk about whitening toothpaste, I've heard about so many other methods to whiten your teeth, right? So can you elaborate on some of them and their side effects?
Yeah. So whitening toothpaste are going to be the least effective of all.
Okay.
So above
Probably
them,
that causes the minimum side effects, is it?
yes.
Okay.
So above them, you also have whitening strips. You have semi-custom trays for tooth
Okay.
whitening, fully customed trays for teeth whitening, and also you have in-office procedures where the dentist will do the whitening for you. So to be more effective, the in-office procedure is going to be for the fastest, the quickest.
Right.
Yeah. So the bleaching agent we use here will be the hydrogen peroxide or the carbamide peroxide, and we'll protect your gums before we bleach the teeth, and it may take over 30 minutes to 1 hour procedure, and it really has a very huge impact on the teeth. But if you have sensitive teeth, we would advise you not to go for it.
All right.
And after that, when you come to the customizable trays or semi-customizable trays, they are those which you can try it at home.
Okay.
So they will have some gels of hydrogen peroxide, which you can fit into your teeth, and it's an at-home procedure actually. And teeth whitening strips are also effective. Those having hydrogen peroxide, of course, when used on a very long basis, will have a sensitivity issue. And there are also other whitening tooth strips. So there are whitening tooth strips. When you want to go with whitening tooth strips, you should know what your whitening tooth strips actually contain.
Okay.
So few contain hydrogen peroxide, few contain something called PAP and hydroxyapatite, few contain sodium bicarbonate, few contain coconut oil. So depending upon the ingredient, the effect also varies. So the most effective is hydrogen peroxide.
Okay.
But it's also going to have side effects. And the others are without side effects.
Okay. So when you said hydrogen peroxide has got side effects, what are the side effects we are expecting? And you said some of them do not have side effects. So what, how would they be helpful? Could you elaborate on them?
Yeah, sure. Like hydrogen peroxide, the main side effects would be sensitivity. So whitening strips, when they're used for a very long time, it's going to have...
How often do you think we should use?
Maybe twice in a year, not more than that, when it contains hydrogen peroxide.
Oh, twice in a year?
It's for whitening strips.
Okay.
But whitening procedures, depending upon your sensitivity, we may limit it to once in a year, or if you have sensitivity, we may also restrict.
That less. So I keep hearing people of, they're going out on for a function or on a party, and then they just use the strips, they keep telling me. So you shouldn't use it that often.
You shouldn't.
Okay. That's something which everybody should hear. Okay.
But those which do not contain hydrogen peroxide, they are safe to use.
Okay. So that how often do you recommend those?
You can use them as long as the result
Okay.
the
So you can use them quite often. So
Quite
maybe people who say they use it often, like
3
before they
times
step out or something like that,
they can.
then they use it probably. They use the other
Yeah,
ones.
and each whitening strips comes with around 10 to 15, 10 for the upper and the 10 for the lower.
Okay.
So each time you do it for 10 times.
Oh, all right. So that's quite decent number of times. So what ingredients you should absolutely avoid when you're looking at whitening strips?
There's nothing like like if you're very sensitive, avoid hydrogen peroxide containing ones.
Okay.
That's the only thing.
All right. So you said everybody should get their teeth checked every 6 months. So we have master health checks during that time. I don't think dental health checks are
Yeah,
considered. They are.
they are.
They come in as a package many a times, right? But sometimes they're not added. I was thinking some hospitals do it. I know. But then what I want to know is there are many a times I see in master health check itself. Many people say this is just a money making gimmick. You just go and check and then they'll say something to you. And some people even believe that, until and unless diagnosed, we are at peace. So at least we know that we are happy with ourselves. So that there are ways and means to take it. It's different for different people. Though I would, as a doctor, suggest that checkups should be regular and should be done dedicatedly so that you know that you're keeping yourself fit. And if something is wrong, then take care of yourself and prevent any further damage. Okay. Keeping that aside, let's start with how you can reverse caries, like a cavity.
Okay. So to start with, not all cavities are reversible.
All right.
Okay. So those which are in the initial stages, which show themselves as white spots, only those cavities without a break in the enamel are reversible.
So that's pretty early in the
That's very pretty early. So these are detected. They should be detected early.
Okay.
So when you come for a biannual checkups, like we can detect it at this point of time itself, and we'll give you extra. Like we may give you nanohydroxyapatite toothpaste or the phosphate and calcium containing toothpaste, and some diet modification, some lifestyle modification we may suggest you so that you improve on the cavities.
Okay.
So once there is an enamel breach, once it's gone very deep into the dentin, or once you have a pain, once it goes into the pulp and you have a pain. So these are the conditions where a cavity reversal cannot be done.
Okay.
So prompt treatment has to be done for them. So for the initial caries, I mean, for those which have a breach, normal filling would do. But those which are very deep, are very close to the pulp, giving an alarming sign of dental pain. So you'll have swelling. People will come with a very huge swelling.
Mm.
So when you come with those kind of very severe infections, if you have enough tooth structure, then we'll go for a root canal treatment.
Okay.
But if a tooth structure is completely gone, you don't have the crown part of it, you have only the root which is inside the bone, or it's very badly damaged, the tooth is very badly damaged, we may ask you to extract the teeth.
Oh, so quite a scary one.
And nothing is as good as your teeth.
I know. And so it's prevention is better than cure.
Yeah. And
The
even
only
for kids,
hospital-
it's always prevention is better than cure.
But in children, like when we see them before, especially when they're having their milk teeth, and if that is having a cavity, I mean, you tend to overlook it. Is it fine to overlook it, or you should take care?
It should be taken care
Yeah.
of. It should be taken care of. Like one basic reason is like when it comes to childhood caries, you can actually divide them less than 5 years. Those in a stage where the children can tell you that they have pain, in a stage where the children cannot tell that they have pain.
Okay.
So generally, when it comes to very young kids, the most common caries that we note is something called as nursing bottle caries.
Okay.
So what happens here is whenever a child is being bottle fed and the mother does not clean the teeth well, and overnight the child sleeps with the bottle in the mouth, so you have milk deposits over the teeth. Bacteria act on them, produce acids, and there are decays. So what happens is when you see the kid, there'll be all black stumps. The entire upper row will have stumps, and the lower row will have stumps. And almost every teeth would have been gone by the time they come to us. So one thing is it can have a psychosocial impact on the kid itself, and the pain also would
Psychosocial impact is quite heavy here
Yeah.
because kids are very conscious about their
yes.
So you got to be really careful,
Yeah.
right?
And most importantly, it also can, when it becomes a huge infection with lots of swelling, it can also cause a damage to the underlying permanent
Oh,
tooth.
really? That can also
Yes,
happen. Oh,
that
right.
can
Okay.
also become malformed.
Oh, they'll malform, is it? Okay. So that's news. Because I think earlier times when we were seeing kids and all with caries, we used to tell them, yeah, it's okay now. This teeth will anyway fall off, so it
Yeah, it
doesn't
depends
matter.
on the time. Like
Yeah.
you expect the teeth to grow off very soon, and maybe in another 6 months, then we may ask them to go for removing the tooth,
Okay.
or we may ask them to wait. But when it's very early, like you have a caries at some point of time, and the next tooth is going to erupt only after 5 6 years,
That's
then
going to be a
it's going to
problem.
be a huge problem. And also, when you remove the teeth, when it's in an unsalvageable condition, when you remove that teeth, there's a migration of the adjacent teeth. So the underlying tooth cannot erupt, and it will cause another set of problems.
So on the whole, you should avoid caries. That is, avoid cavities in your teeth. And for whatever action has to be taken, it has to be taken quite early.
Yeah.
It's something which we have all to realize.
And the rare possibility is whenever there's an infection, which can the tooth infection, it can also spread into your throat, and it can cause life-threatening breathing difficulties.
Yeah. Not only breathing difficulties, there are many other problems, right? Especially when you are having a cavity in your adulthood and or later in life also, you can develop a lot of problems, right? That includes heart issues also.
Yes,
Yeah. So can you just? I don't want to scare anybody by saying it, but
It's something which
nevertheless the
people
truth,
should know.
right?
Yeah, it's something.
So
people
we
should
have to know about it. So Dr. Padhumai, please elaborate on that also.
Okay. So apart from dental caries, you can also have gingival issues. You can have bleeding gums, you can have inflamed gums, you can have tooth mobility. So whatever is the bacteria which causes them. So when there's an inflammation in the gums, there is a lot of bacteria entering the gum through the bloodstreams from the gums. It can travel through the entire body. So for instance, it can go sit in your heart valves, or wherever the heart tissue is weak, it can cause infective endocarditis, and also it can cause platelet activation in the blood vessels, which can result in blood clot. So that is an increased risk 2 to 3 times higher risk for getting heart attacks. You can have strokes. Apart from that, whenever like you can have pneumonia, or you can have if it's going to be a pregnant woman, she can also have low birth infants or a preterm labor.
Oh my God, that's like scary. Chills down your spine actually, because you don't take teeth so very seriously, is what I guess. But then teeth is one very important aspect which has to be, and everybody harps on it, how it has to be kept clean and how you have to have oral hygiene and all these things are told. But nevertheless, you never ever 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 think that it can cause so many internal problems because you think it's just here and you can just gargle and spit it out. So that's a lot of interesting information. You told us about a list of conditions which are like quite alarming to have if you have a dental problem, right? So, as a dentist, is it possible to see conditions earlier than other doctors would diagnose? I mean, on the skin, you see a lot of conditions, So we will say this is a heralding sign, or probably there's something internally, and probably that's why this is there. So, do dentists also do that?
Yes, we'll be able to see a lot of conditions, especially like diabetes. So people will come with us with lot of periodontal issues. They may have mobile teeth shaking, and finally, when we come to a reason, like when we look deeper into it, and we just ask them to go for a routine blood checkup, they'll have diabetes. They'll be diagnosed with it. So for diabetic people, even when the plaque content or the dirt around your teeth is very little, you'll have a lot of mobility.
Oh.
So that is one thing that can be
This
seen.
can happen earlier in life also, or it's just that it happens later on in life if you develop diabetes, or it's a long-term diabetes which is causing it?
It is a long-term one.
Okay. So if the sugar is not under control, then you can see something like this. But it is not like when you're younger, you get it and then you'll see this mobility, right?
No, not like that. So the next symptom which you can see is bleeding gums. So we say only whenever we have inflammation around the teeth, or whenever there's plaque accumulation, or whenever there's a gingival problem, there may be bleeding gums. It's just not just that. Bleeding gums can be an initial sign of vitamin C deficiency. It can be a sign of platelet deficiency. It can be a sign of leukemia itself also sometimes.
So that's quite scary. But
Yeah.
there has been diagnosis made because of bleeding gums.
Yes, there have been. So this is one thing, and various oral ulcers, because of vitamin B12 deficiency or other vitamin deficiencies, that can be oral ulcers, which itself can cause halitosis, burning sensation. People may not be able to eat spicy foods itself. And another issue is gastric ulcers. Whenever people who have gastritis or GERD, they have acid reflux. So what happens is that acid itself can cause erosion of your enamel. So whenever you vomit or whenever you have the GERD symptoms, the enamel layer will become thinner. So that is one thing which we can observe. Anemia can be observed, or even HIV. Sometimes even oral manifestations of human deficiency virus will be the first sign which we ever see.
That affects everything. So we have a lot of things in skin to see. Now we have a lot of things in dentistry also to see. So that's yes. So there's a lot more than what we imagine and what we think the teeth is about. Nowadays, flossing is such a fad, right? Everybody who carries a water flosser with them and uses it. So you think if like, of course, it helps when something is stuck in between your teeth or something like that, or hard to get areas and stuff like that. So when you look at flossing, do you think that, if you brush lesser or you don't use a proper this thing and you floss it, it's fine? Or I mean, what's your take on floss, water floss especially?
Okay. Flossing is not an alternative.
Okay.
So brushing is must. Brushing should always be followed by flossing.
Okay.
So it's always that way.
So it's like clean, then ultra clean, is it? Yes. And a water flosser is a good idea?
It is. It's a very good idea because it not only helps in flushing out the food that's stuck between the teeth, but it also helps in massaging your gums.
Okay. So how will that help in oral health?
There's inflammation or whatever has happened, that will go off. And when the gums getting massaged, it stays strong and healthy.
Oh, okay. That's quite interesting.
But it all works only after the underlying disease or condition has been removed. So whenever you have a pre-existing tooth mobility or an inflammation, you should have a scaling done first.
Okay.
Followed by proper oral hygiene techniques like brushing twice a day. More than brushing twice a day, it's almost the technique which is always important. You should always hold your bristles at a 45-degree angulation to your gums and then give up and down motion. And you should also brush all the surfaces of your teeth. And after that, you can go with flossing.
I know when you spoke about brushing, so do you think that, electric brush would be better than a normal brush? Because you said 45 degrees and how to hold it and stuff like that. Electric brush does the job more gently, is it?
It's the pressure always.
Yeah.
So even when you're using an electric toothbrush, of course, electric toothbrush is better than normal toothbrushes.
Okay.
But when you're going to
say that?
The number of strokes per minute.
Okay.
That is.
Okay. So they calculate and they'll do their job.
Yeah.
Okay, that's better. Okay. So and bristles, when you talk about bristles in a toothbrush, there are so many, right? Nowadays you get disposable ones, biodegradable ones, and then there are something like fine hair ones which I've seen, and I've heard that causes a maximum damage. I was quite shocked to know that. But can you elaborate a little more on the bristles? What type of bristles you should choose for making sure that your teeth are healthy? You don't get sensitivity, you don't get cavities. What would you suggest?
It's actually a soft toothbrush.
Okay.
So whenever you buy a toothbrush, it says soft, medium, hard, ultra soft, sensitive. So you should always pick up a soft one, despite the arrangements, despite the make. You should always choose a soft one and be gentle. Like you use a moderate amount of pressure, not too hard pressure. I've seen people brushing horizontal like this. They want to have it super clean, and they finally end up having abrasions. They have on the sides of the teeth, they have enamel abrasions seen. So always go with a moderate pressure.
Okay.
Use soft bristles. And always change your toothbrushes once in every 3 months,
Okay.
because that itself can harbor lots and lots of bacteria,
True.
which can make you sick later.
I've read articles about how Gen Zs get more cavities. It's not that they don't brush or they don't take care. On the contrary, they're more conscious, I believe. But in spite of that, they get more cavities. Why is that so?
It's because of their lifestyle changes and dietary changes, mainly.
Okay.
So they are like these generation people are more towards fast foods, more towards seeing lots of movies, late time snacksing, and they forget to actually rinse their mouth.
Oh,
So that happens. Lots of sugary substances.
yeah. I think the drinks also, which they
Yeah,
nowadays.
the energy drinks, where they have lots of acid content in that. Rather
Oh,
than,
okay.
even if you go for non-sugary ones, they have lots of acid contents which can demineralize the enamel. So that itself can cause
So over a period of time,
it will cause an acid attack and also erosions.
oh, okay.
Decays also can come.
Oh. So you have to be careful. So diet really links up to a lot of things, not only
So
your
eating a lot of
thing,
fibers also do matter in mechanical cleaning and
Okay.
also deficiency managements.
Okay. I've seen patients who have sinusitis have severe sensitivity in their teeth, and they find it very difficult to chew or do things. I mean, how is it related?
Okay, sinusitis rather than sensitivity, what I would precisely say is they get a lot tooth pain.
Yeah, they
So,
complain of tooth pain.
what they initially think is maybe they got a cavity or they've got periodontal problems. But when they come to us, what we see is it's a completely tooth. It's completely healthy teeth. Even the X-rays are normal without any pathological conditions. But because of the sinusitis, there's like especially in the upper molars. Happens especially with the upper molars. So upper molars are very close to the sinus cavities. Sometimes even the membranes, the sinus mucous membranes of the sinuses are on the teeth. So whenever there is a sinus inflammation of the mucous membrane inside the sinus, it can mimic as a tooth pain, but it's actually not a tooth pain itself.
So you got to be careful.
Yes. So you see, you have no dental issues. Your dental issues are completely fine. Then you go with the extra ENT investigations.
Okay.
You
That's
have
quite interesting.
yeah. You can also ask about history of cold or whether they have history of sinusitis.
Okay.
All these are helpful in diagnosing the.
So that explains that, systemic problems are also reflected in your teeth, and your can also cause systemic problems. So it's not only the small cavity we are looking at, but there's a lot more. So, when you have a tooth decay, it's not always that, you just immediately find out and say, or you're checking your tooth, like, looking into the mirror to find out what is wrong. But then, so what would be the things you should think, like if somebody wants to find out that probably they have a tooth decay or they got to get them so checked, if they're not doing their routine checkups, then in that scenario, what would you say are the heralding signs or, signs which they should look for and think that probably I have a tooth decay?
Okay. So probably the one of the few first signs of dental decay, like maybe when you don't see but symptoms rather than signs, I should say it should be symptoms, would be hypersensitivity. Like you have a sensitivity, you take a very hot or cold food and you get sharp shooting pain on your teeth. So that itself could be a first sign of decay.
Oh, okay.
Because that happens only when the enamel is breached. So that could be a sign. And after that, as it goes more deeper and deeper, you start getting a sensation of pain.
Okay.
So this is when the body rings an alarm saying that it's very close to the pulp and go see the dentist.
Yeah, when pain is there, you'll run. But before the pain begins, I think you should be aware that you're going through it. And the earlier the diagnosis, better the treatment.
Better the treatment.
And at that stage, probably prevention is also there.
Mm.
You can prevent for further tooth decay, right? You were talking about symptoms for tooth decay, early symptoms. That one you said was sensitivity. What about bad breath?
Yeah, that will also happen.
Yeah.
So whenever you have pus discharge because of a tooth decay or you have very severe periodontal issues, you definitely do have bad breath. And also another sign of bad breath could be your gastric ulcers, your GERD could be a sign of bad breath, oral ulcers, even cancers of the throat can be detected just with halitosis, with bad breath. You can have tonsillitis and bad breath.
So if you have a bad breath, act immediately. Don't think that, it's just because you didn't brush properly or it's embarrassing to show anybody. When we talk about mouth breathing, not only in children, even in adults, some people have it. So do you think that mouth breathing is one of the causes for bad oral health, and can it increase the risk of cavities?
Whenever you have a mouth breathing habit, it means that you are dehydrating. So
Okay.
the cleansing action of the saliva itself is minimal. So hence, yes, it can, especially when you are sleeping with an unbrushed mouth. Yes,
Okay.
it can cause.
So if you haven't brushed in the night and you are used to open mouth breathing, then you got to be very, very careful because the risk is higher, right? Right. But some people say that dental hygiene is related to headache also. How true is it?
Okay, so when you have very severe or very deep cavities, like it's not only the local regions which have the pain.
Okay.
So sometimes it's referred. Sometimes a pain in the jaw can cause a pain in the TMJ region, or it can cause a pain somewhere in the neck radiating, or it can sometimes even cause head pains.
Okay. So possible.
That it is a possibility. It is
But
a
it's
possibility,
like
but it's a
very
referred
severe
kind. The
cavity,
referred.
or I mean, if it is a referred pain, it could be earlier also, right?
Yeah. And also another interesting fact about while speaking about dental pain, sometimes like we saw something called sinusitis, which can mimic as dental pain. There's also another thing, and heart attack can also mimic dental pain.
That's very, very rare.
Sometimes very rare, very rare, very rare. You can on the left side of the lower jaw, they can have a chronic vague pain,
And that will be not like a sudden heart attack. Also, it will be
a chronic one.
okay. Yeah, I've had read cases about it. Never seen one though. Well, oil pulling is one procedure which had gone viral, right? Everybody heard about it, and there were many people who tried it also. I mean, how much does it help the dental health?
It's actually scientifically proven to improve it and
Seriously?
improve
Oh,
oral
okay,
hygiene.
okay. How
So-
you have to explain this to me now?
Okay, so it's actually scientifically proven
Okay.
that oil pulling can help in oral hygiene,
All right.
especially
okay.
sesame oil and coconut oils. So swishing them in the mouth, and then you have to you have to take them in your mouth. Swish them for at least 10 to 20 minutes, and then after it becomes after it liquefies, you have to spit it out. So it is said that it will prevent, it removes the plaque accumulation. It also prevents further accumulation of plaque, and it improves gingival inflammation, and it also decreases the microbial content.
So it's just a mechanical effect, is it? Or it's
It also has an antimicrobial effect, and that is
Okay.
a recent study which is going on, and it is
Alright,
also being
okay.
scientifically proven.
Oh, that's quite interesting because I had some of my friends who tried it and they complained of severe pain in the jaw and their cheeks. But I think it's good for exercise also,
Yeah.
right? Good exercise for your cheek muscles.
Yeah, it is.
That's quite interesting. So I hope they do a large study so that we can prove it.
And also, side effects using mouthwashes, like certain mouthwashes, they have lots of side effects.
Okay.
So those side effects will not be there in oil pulling.
Okay. Is it advisable to use a mouthwash after brushing? I mean, it will decrease the number of bacteria, so that will help the cavities, is it?
It actually depends on how your oral health is. If it's going to be a lot like caries or a lot periodontal, that you're going to have lots of periodontal issues, then of course the dentist may recommend you certain mouthwashes, especially antimicrobial ones like the chlorhexidine mouthwashes. But it also has to be used with caution because it not only kills the bad bacteria, but it can also change the microbiome inside the oral cavity.
So the oral flora itself will be shifted a little.
Yes, that is a shift. That is a shift. And hence, only for the prescribed period of time it should be used and not more than that.
Okay.
So frequent usage of antimicrobials can also can cause not just a change in the oral microbial flora, it is also said to increase, especially chlorhexidine, it's said to increase your blood pressure.
Oh, okay. By using it just orally and gargling with it?
Yes, what it does is it is said that behind in the throat, like there are bacteria which produce nitric oxide, which helps in reducing the blood pressure. So when that is deranged,
so the normal flora is should be retained whatever it takes.
Yeah. So unless and otherwise prescribed, don't overuse mouthwashes.
So that was a very good conversation with Dr. Padhumai. We had so much of knowledge and so many new things which, we have sometimes heard of and we think it's not right. And sometimes we just, brushed it off. But you have broken quite a few myths and you've enlightened all of us with so much of knowledge. Thanks a lot, Dr. Padhumai. Nice having you.
Thank you.